Hope you are fine. Today lecture is related to care after tooth extraction. Patient presented to us with severe tooth pain and the condition of their tooth or teeth is that only one option remains of tooth extraction. Their teeth are unrestorable. So when we anesthetize the teeth and extract or pull out the offending tooth, the remaining area after tooth extraction is very critical, especially during the first 24 hours. We need special care of this area. Nature gave a gift to us in the form of blood clot, which is very helpful in healing of the extracted socket. If we disturb that blood clot, the process of healing will disturb and pain will increase more than it was before, and pain will radiate to head, neck, and ear area. So, what should you do after tooth extraction? Number one, in first 24 hours, eat soft and cold diet like yogurt, milk, bread. And second important thing is don't rinse repeatedly and aggressively as it can dislodge the blood clot forming in the tooth socket. Third important thing is avoid hot foods like hot tea, hot coffee as it will increase the bleeding from the extraction site. Fourth thing is avoid hard items to bite from that side as it can injure the healing area and dislodge the blood clot. Fifth, never suck on that side. There are multiple things which can create negative pressure in our mouth like coughing, sneezing, use of straw, smoking, very common thing. So we should avoid these things in order to preserve our blood clot. These are simple but important things. Some people are have habit of sucking candies which are very harmful in the disintegration of the blood clot. So always after extraction give rest to your body. Some persons after extraction of their teeth go to gym or walk or heavy exercise which results in increase in blood pressure of these patients and bleeding tendency will increase. So after tooth extraction you need complete bed rest and elevate your head level so that bleeding from the extraction side will be minimized. So these are very important and little tips which you can use after pulling out of your teeth to preserve your bone, soft tissues and remaining structure in good condition. Avoidance of smoking is very important as some patients are addict of cigarette smoking. So just after tooth extraction they start smoking and it will result in disintegration of the blood clot and which results in drying of the jawbone. Nuded jawbone will dry out and results in severe pain that will radiate to head, ear and neck area and patient will get into more trouble as he was before the tooth extraction. So it is advisable to care after tooth extraction. Never use negative pressure things like sucking candies, use of straw for juices, cold drinks, hot items. Always use cold and soft diet after the tooth extraction. After 24 hours of tooth extraction, when the clot is stabilized, you can use a natural mouthwash with hot saline rinses or can use an antimicrobial mouthwash with chlorhexidine or acetylpyridinium chloride, which can wash out the impacted food debris in the extracted socket. While in case sometimes wound healing will be delayed in patients suffering from diabetes mellitus, patient taking steroids, patient on smoking, patient having some foreign body impacted in the extracted socket. So if these problems are encountered, you will get an early appointment to your dentist to resolve that problem. Otherwise, the healing of the socket at extraction side will be delayed and you will get more trouble in the future. Hopefully, this video will be informative to you. If you are new to the channel, subscribe and like, and any question related to this video you can ask in the comment box. Thank you.